So welcome, Hilary.
Thank you.
Now, tell me, what year are you in?
I'm in second year podiatry.
Okay. We specialise in the musculoskeletal side of the biomechanical conditions that people present with. So what I'm going to do today is I'm just going to give you some orientation about the services that you'll see provided as part of your observation of what we do here. You're going to see on this chart here, it's the IDEAL journey flow chart. Now, IDEAL is actually an acronym. So, and it stands for, I being the initial contact, D is the determination of whether we can actually help a particular inquirer, E is the examination that takes place, A is the assessment of all of the findings that we'll undertake, and then L is the long-term care. So there is an ideal journey that people will go through, but the acronym IDEAL actually is a big part of working out whether we can actually help the particular individual. We quite specialise in the way we work, so a lot of the initial assessment is about just finding out whether we can help these particular individual cases. So the idea of this flow chart is to see the logic and the order of what's taken place. Now, as you observe this afternoon, you will see people coming at different stages of their journey. So, just so that it kind of makes sense and doesn't look completely like organised chaos, this will help put things into order. So, initially, there will be people who make an initial contact with us. So whether it's through an advertisement, it's through a word-of-mouth referral or a professional referral, somehow they'll make an inquiry. So the new client inquiry will typically, it'll happen at the front desk, either by telephone or online, or people walking in through the front door. So the first port of call are the GAs at the front desk. GAs? What's a GA? Have a guess.
Just A stand for admin?
Funny you should say that. No.
Oh, no, I have no idea. Wrong part.
Yeah, well, we had a podiatrist come and visit us last week. I asked her exactly the same question. She went, general administration. I thought, you know what? That sounds really boring. And I said, that's not right. No, our GAs are the guiding angels. The reason for that is there are a number of steps that the clients needed to be guided through, and it's a crucial part of the whole foot and leg experience, and they are the angels that guide the clients through every step of the journey. As practitioners, we just do what they tell us to do because they run the show. So the GAs, the guiding angels, will, with the initial inquiry, determine whether we are the right place for the person who's inquiring. We don't do any general treatment or routine treatment, so any corns, calluses, ingrown toenails, anything that's guzzy, we don't do. So, and going back in time, I used to be a general podiatrist. When we first opened up here in 2002, there were people who would sort of follow on and say, oh, you know, can I see Ted for that type of problem? And so since probably now it'd be at least the last 15 years I've not picked up a scalpel or nail clippers, so we don't do any of that type of work. Not that that's not important, it's just that it's not what we choose to do, this is what we're interested in doing. So we'll have a new client inquiry that takes place. If the angels work out, yes, this is the sort of problem that we can help you with, or we think we can help you with, then they'll get booked straight into an initial consultation. So the codes here in NC2, they are administration codes that get logged into the computer, and it just, the N stands for new, NC is new client, and then the 2, 3 and 4 relate to different sources or different fee options that would be applying to that particular client. So you don't have to worry about that, but that's why there are a number of different options there. In that initial consultation, which will take place with the practitioner, the practitioner will determine what's the next appropriate course of action. And essentially it'll go down two parts. Either one, yes, we can help them, or two, no, we're not the right place for you. If not, then they'll be referred on to someone else, or another course of action will be recommended. If we suspect from a clinical perspective that we can help that particular client, then our next standard procedure is actually to get a series of weight-bearing x-rays. The weight-bearing x-ray is a way for us to measure in a clear, objective, black and white, no questions asked manner of what their biomechanical or structural relationships of the bones and structure within the foot, how they're actually situated. So the field of biomechanics, bio means body, mechanics means mechanics, so it's just the mechanical function of the foot. You'll hear us speaking to our clients saying, if you think of feet and legs like wheels on a car, what we do is we check your wheel alignment. Everything works best when it's in the right place. And the wheel alignment test that we do clinically helps us work out, is this body working at its optimum? If through that clinical assessment we see, oh, the wheel alignment may be out, or the body is being forced to compensate, then we will organise to get the x-rays taken so that we can see exactly what the foot structure is doing from the inside. When you look at these x-rays here, you'll then see how we've got these yellow lines, we've got these numbers here. So that's basically a way for us to be able to measure what the important key joints within the foot are doing. And when we look at the foot structure here, you'll see how the toes and the ball of the foot is like so. And then when we look down, these are the ankle bones on the outside. Inside the ankle is this bone here, the crucial bone, which is the talus. You got it in one. And what was the talus called before it was called the talus?
You told me this and I can't remember.
Astragalus.
Astragalus.
And what does astragalus mean? It's Latin for?
My Latin's not very good.
Okay, you don't speak Latin?
No,
it's a lost
sorry.
language. Astragalus is Latin for centre of the universe.
Oh wow.
Yes, so structurally the talus is the centre of the universe for literally postural stability. You cannot have a strong, well-balanced physical skeletal structure without a well-positioned and stable talus. The talus is also, it works like a key. It literally locks and unlocks the rest of the foot. It's crucial for strong foot function that the midline of the talus and the midline of the foot form an angle that's within a normal parameter. Now, you don't need to know about what normal is and the difference, but you'll see here now, there's numbers and there's angles. That's part of our biomechanical assessment, because then we can work out if the talus is in the right position, the surrounding muscles, ligaments, tendons can work as nature intended. But if the talus or any other bone is out of position, the surrounding muscles, ligaments, tendons are forced to compensate. The compensation is what people feel, and that's usually what we're working to resolve. Now, technically, we don't actually treat anything. You won't see any ultrasound, you won't see any ice packs, you won't see any heat bags or therapy massage happening like in a physiotherapy practice. What we do is organise the joint structure, get things into the position that nature intended, and then the body actually heals and repairs itself. That's where the magic is. It's not us treating anything. What we do is remove the interference so that the body can actually heal and repair itself. Does that make sense?
Yeah.
Okay. It kind of flies in the face of what you're taught at university. You're taught, here's the symptom, assess the symptom, differentially diagnose what it could be, and then you apply treatment to get rid of the symptom. We don't work that way. We believe that the body is capable of actually healing and repairing itself. Our job is to remove the interference or remove the elements that are stopping it from actually achieving that. If you think about it, if you cut yourself, you don't go, okay, platelets, I need you to block that up right now. Okay, the macrophage, I need you to come floating down here so that you can destroy any foreign bodies there. You don't think about that. Your body does it automatically. That's just part of homeostasis. So that's just the facts of how bodies are. So what we do is remove the interference so the body can go, oh, thank you. Now I don't have to compensate. Now I can get on with repairing, which is what it does all the time.
It's just empowering someone. I really like that.
It is, and the people, our favourite people to work with are those people. We are helping the body help itself, and our favourite clients are those people who want to help themselves. So it's not about masking the symptom with the drugs or medication or strapping or that. It's about let's help the body help itself. Because it's trying to, it always is. We just give it a little bit of a nudge along. So, and you're going to hear and see this afternoon dozens of people who have gone very successfully through it. It's what our practice has been based on for, I've been in practice now over 30 years, so yes.
Awesome.
Totally. But in order for us to work out what we need to do, we need this type of mechanical understanding. And the X-rays are the most accurate way to see what the joint position is there any interference, is there any arthritic involvement, is there any history of fractures or other type of injuries. The X-rays are the most reliable way for us to work that out. So once an X-ray is then taken, Becky, our radiographer, she will then do the analysis as far as the lines and the angles.
Yeah.
Then what we will do is we will go through the results of the X-ray with the client. And that's the NRV, which is the New Client Review Visit. At this visit right here, we will outline to the client, okay, this is what our findings are from an X-ray point of view. On your last visit, we had the clinical assessment. We bring that together with the X-ray results. Then we can map out what the treatment plan is for that particular client. And we'll get started on that visit with their first treatment. Now, true healing is when the old damaged cells are replaced with new healthy cells. In the joint structure, this is a cycle that naturally takes around 90 days. So typically our treatment plans are designed to work with our clients over a 90-day period of time. At this NRV, what will happen is we will have worked out how to help that client, but at this point it's just a theory because we can work this out, but we haven't actually put our treatment to the test. So what we'll typically do is we'll work and help and treat that client for the first month, and then at the end of the month just reassess how we're doing. If we can see we're making progress, then we'll complete that 90-day cycle. The reason why we do that is because that's the way the healing cycle of the body works, and that's the old damaged cells replaced with new healthy cells. It's working with the body to help the body help itself. So it's a very clear physiological reason for that. Make sense?
Yeah, cool.
Right. At the end of 90 days, we will then do a follow-up X-ray. So we can compare before and after and make sure that we've got the problem resolved. So, NRV is when they have the results of their X-rays. We'll work on them for a month, and then we'll have our case review solution visit. So the CSV is just a clinical re-evaluation to see at the end of the month, are we heading in the right direction? Yes, okay. Now we'll continue, and then we'll continue until the review visit. So that's at 90 days. That's when we'll do the follow-up X-ray. Now, at that point, we would typically anticipate that we've got the structural corrections taken care of. Then it's a matter of working out, well, how do we keep things in that position and keep that in place? And that's done primarily by the client themselves, so whether it's through exercises, activities, and that's worked out on a case-by-case basis. Ultimately, our aim is to have a maintenance service that we do for our clients. Typically see people once or twice a year, a bit like a dental checkup, and they will do most of the work for themselves. So kind of like if you did have some dentistry done, some root canal or something significant. Once that's done, your job is then to clean and floss and maintain your dental health. That's the same with us. Now, from our point of view, the exercises that are involved are really quite simple and straightforward. You can literally do them while cleaning your teeth. So what we do is, within the course of the first month and the first 3 months, is we actually ingrain those exercises into activities that people are already doing. So usually that's either cleaning their teeth or in the shower. They're the two most common times when people do them. Because if you have to think about doing the exercises as a separate activity, chances are they're not going to be, and the physios will tell you, compliance is a real hurdle, a real obstacle. So we've designed the exercises so that they're simple and easy to do, and then done consistently to maximise their benefit for the long-term effect. Make sense?
It does.
Doesn't it? It's not that difficult. I mean, it's not rocket surgery. Get it? Okay. Right. So what you're going to see, these are the key benchmarks. So the initial consultation, the report on the x-rays, the 1 month follow-up, and then the 3 month follow-up. And in between these stages is when we actually do the hands-on foot mobilisation work. So this afternoon, what you'll see is the first session from 2 till 3 is what we call prime time. People are coming in, get their mobilisation, and then get on with their day. The actual hands-on treatment itself doesn't take that long. It probably all up might take hands-on perspective up to 5 minutes.
Wow.
And people, when they first start with us, the body responds best when we do a little bit regularly. So typically what will happen is we'll be seeing people twice weekly. Now, everyone's time poor. So we've got to make sure that we respect people's time. So what you'll see is that we have a bit of an open house arrangement. People come in, get their treatment, and then get on with their day. And so that it minimises the time that they spend here. And that's really important to make sure that you're respectful of people's time. So sometimes it can look a little bit unusual. And we know we do things differently here. But just to give you some forewarning, that's what's going to take place. Right. So Hilary, any questions about anything I've covered so far?
After that 1 month and the assessment,
Yes.
how would treatment go after? Is it still that twice a week?
Okay, it depends.
Oh, okay. So
Absolutely depends on what that particular client's needs, circumstances, how much progress they've made. In a typical case, we would anticipate after that first month somewhere between 30, 40, 50, 60% improvement. So everyone kind of varies between that. And often you get a lot of good improvement and then it tapers off, so you get the full benefit by the end of the 3 month stage. But the majority, the lion's share of the work is done in the first month, and that's where it's most intense with the higher number of visits and the highest load of exercises. So from that point of view, yeah, that's where most of the work is done. Some people continue on twice weekly, but not that common. Often they'll go to once weekly, fortnightly, and gradually we go through a weaning off process over time.
And what's the average age of each client?
It's probably our youngest. The foot mobilisation work doesn't work well. It works well on growing bodies. You can adjust the joints very effectively, but it doesn't hold and maintain particularly well because they're too flexible. So typically, the best clients are those cases that the bones have stopped growing. So teenagers upwards is normally this type of corrective work. We do have some people who are approaching middle age, so in their 70s and 80s, and those, sometimes they ask us, well, am I too old to have this done? And actually, no. One of the fabulous benefits of mobilising joints is it stimulates the synovial fluid, the joint's oil. And so often those joints that have covered a lot of miles and they're kind of a bit older and a little bit dried up, they benefit fantastically because it stimulates the juice in the joints, and they really, for them, you don't have to make much difference to be a world of difference from their perspective. So this time of day, we'll see probably a number of retired people and more towards that end of the age spectrum. And then around 4 o'clock is the after school people who come in, and then around 5:30 is when the after workers come in as well. So yeah, we have a broad spectrum of age ranges that benefit from our work.
I think you've covered it all. The flowchart's really good. It's quite thorough.
Good. That's the idea. And it's the advantage of being specialised in this field. So given that this is, yes, the only service that we provide, it's then working out, are these people going to be suitable for this service? And then if so, we just map out, this is, because we know this is the best way to look after people. We now have in excess of 15,000 clients that we've looked after for here in the Foot and Leg Centre. And I was doing this work for probably 6 or 7 years before then, developing the most effective way to look after people. So yeah, it's been refined extensively to the point where now we know that the bodies respond best when we flow the sequence.
So from a client's perspective, each time am I going to be seeing the same practitioner, or is it more a teamwork scenario with whoever's available?
Okay, great question. From our point of view, we think it's best if people see a number of different practitioners, because then what happens is it's almost like you get different perspectives. You know, 2 heads are better than one, the old expression. However, each practitioner will have what we call a case manager. It will typically be the person that sees them for the initial visit, then goes through their X-ray results, and then performs the follow-up visits, so both the 1-month review and the 3-month review. But in between time, they may see a number of practitioners, or they may see the one practitioner. There's absolutely no difference in the results that they achieve, whether they see one or the other. So,
And how do you document their journey? Is it consistent in each consultation, or
yes.
after?
Yeah, good question. So we have what we call our treatment protocol, and what will happen is you'll see each client, they go to the front desk, they're given their card, and they will walk the card down the passage to the treatment area. Then the practitioner will record every time we check every person, every foot the same way. It doesn't mean that we will actually mobilise or treat every joint in the foot. What will happen is we will check every joint the same way, and then if we need to do any work, if we notice any restriction or limitation or block, then we will actually work on that. So we've got a protocol of, depending on what your foot type is, either 10 or 12 techniques, and that's just the standard protocol. If there's anything different that's done outside of that protocol, then that will be recorded in as well. So we have an abbreviation code of, this is the treatment protocol for the pronated foot type, or the treatment protocol for a supinated foot type. And if you have something else that needs attending to, whether it's a technique on the knee or on the hip or some other part of or a different joint, then that will be recorded separately.
Fantastic. I think that's all.
Good.
Questions.
Great questions, Hilary. Well done.
Thank you.
Terrific. So what we'll do now is we'll head out to prime time. I'll give you a bit of an orientation, see what's going on and who's doing what. And then Benito and Tito will share you through the course of the afternoon, so that you get to see as many different types of services or of each of these being conducted as possible. Excellent.
Fantastic.
Let's go have some fun.